The Amish never stopped using the medicine the rest of America forgot. While pharmaceutical companies bought television ads, Amish communities kept doing what their great-grandparents did. Number 12 costs 40 cents and outperformed a prescription antifungal in a clinical study. Number 5 treats a condition modern medicine calls one of its most difficult. These are 25 Amish home remedies that still work today. Number 25, black seed oil. Nigella sativa, the small black seeds from a flowering plant native to Southwest Asia, arrived in Amish communities through the Pennsylvania German tradition, where it was called Schwarzkümmel, and had been used medicinally for centuries in the Germanic herbal tradition. Amish healers used it for respiratory complaints, digestive ailments, and as a general immune tonic given during cold and flu season. A tablespoon of the pressed oil daily or the seeds ground into food. The Arabic medical tradition had a saying, "Black seed cures everything except death." That is hyperbole. The pharmacology is not. Thymoquinone, the primary active compound, has confirmed anti-inflammatory, antioxidant, and antimicrobial properties. A 2013 meta-analysis in the Journal of Ethnopharmacology, reviewing 33 studies, documented significant anti-inflammatory and immune-modulating effects. A 2014 review confirmed broad-spectrum antimicrobial activity. The Amish household that kept black seed oil on the shelf was maintaining a pharmacological tradition older than American medicine by several thousand years. Number 24, oil of oregano. Oreganum vulgare, the same oregano used in cooking but prepared as a concentrated essential oil, was a standard item in Amish medicine chests. A few drops under the tongue at the first sign of illness. Mixed into water for throat infections. Applied topically to nail fungus, skin infections, and infected wounds. The Mennonite herbal tradition that informed much of Amish medicine had carried oregano oil from European practice, where it had been used as an antimicrobial since at least the medieval period. Carvacrol and thymol, the primary active compounds, have the broadest documented antimicrobial activity of any essential oil compounds studied to date. A 2001 study in the Journal of Applied Microbiology found carvacrol effective against 25 different bacterial strains. A 2011 study confirmed significant activity against Candida albicans, the fungal pathogen responsible for most yeast infections. 40 cents worth of oregano oil at the health food store, or a bottle from the Amish bulk supplier, delivers the same active chemistry. Number 23. Propolis for wounds and immunity. Bees produce propolis, a resinous mixture of plant compounds, beeswax, and enzymes to seal and sterilize their hives. Amish communities with beehives, which was most of them, understood propolis as medicine before it was a supplement. Raw propolis scraped from the hive was applied directly to infected wounds, cold sores, and skin infections. Dissolved in alcohol as a tincture, it was given for sore throats, respiratory infections, and dental pain. The antimicrobial activity of propolis is among the most extensively documented in natural products research. A 2016 review in Evidence-Based Complementary and Alternative Medicine identified antimicrobial activity against over 300 bacterial strains, 60 fungal species, and multiple viruses. Artapilin C and caffeic acid phenethyl ester in propolis have confirmed broad-spectrum antimicrobial and anti-inflammatory properties. The Amish beekeeper who scraped propolis from the hive and pressed it against an infected wound was applying a pharmaceutical-grade antimicrobial directly from the source. Number 22. Arnica for bruises and muscle pain. Arnica montana, the mountain daisy, was the bruise medicine of the Pennsylvania German and Amish tradition, applied as a cream, oil, or compress to every bruise, sprain, sore muscle, and impact injury that came through the household. The sesquiterpene lactones in arnica, particularly helinoline, have confirmed anti-inflammatory and analgesic properties. A 2007 randomized controlled trial published in Rheumatology compared arnica gel directly to ibuprofen gel for osteoarthritis of the hands. The arnica gel was equally effective for pain reduction and hand function, with a significantly better tolerability profile. A 2012 Cochrane review analyzed multiple trials and confirmed arnica's effectiveness for post-operative pain and swelling. The Amish grandmother, who rubbed arnica cream on a child's bruised shin, was delivering treatment that performed equivalently to ibuprofen gel in a randomized trial. Commercial arnica gel now sells for $18 a tube at any pharmacy. Number 21. Activated charcoal for poisoning and stomach illness. Long before activated charcoal became a wellness trend in black smoothies at urban juice bars, it was standard emergency medicine in Amish communities for poisoning, food poisoning, and severe stomach illness. A tablespoon of activated charcoal powder mixed in water was given immediately when someone had eaten something suspect or was vomiting from food illness. The mechanism is identical to its pharmaceutical use. Activated charcoal has an enormous surface area that binds to toxins, bacteria, and irritants in the gastrointestinal tract through adsorption, preventing their absorption into the bloodstream. Activated charcoal is still the standard treatment given in emergency rooms for oral poisoning when the patient presents within hours of ingestion. The Amish remedy and the emergency room treatment are the same compound used for the same purpose. The Amish did not need the emergency room because they had the charcoal in the kitchen cabinet. Number 20. Bentonite clay for internal and external use. The gray-green clay that Amish households kept in a sealed tin served two purposes that most Americans today would consider entirely separate. Applied as a paste to infected wounds, insect stings, and skin infections, it drew out venom and bacterial toxins through the same electrostatic binding mechanism as kaolin, the compound that was the active ingredient in kaopectate for 60 years. Taken internally, mixed in water for food poisoning, stomach illness, and intestinal complaints, it removed pathogens and toxins from the gut before they could be absorbed. The Amish tradition of clay medicine came through the Pennsylvania German herbal tradition, which in turn reflected the widespread cross-cultural use of medicinal clay that has been documented on every inhabited continent. Smectite minerals in bentonite have confirmed absorptive capacity for bacterial toxins, and a 2012 study confirmed significant antibacterial activity against pathogenic E. coli strains. Here's what the Amish know that the rest of America has mostly forgotten. Every one of the remedies on this list costs almost nothing. Almost all of them can be made or obtained without a prescription, a pharmacy visit, or a physician's approval. The communities that maintained this knowledge did not do so out of stubbornness or ignorance. They did so because the remedies worked reliably enough over generations of consistent use that abandoning them for pharmaceutical alternatives that cost more and required dependence on an outside supply chain made no practical sense. The Amish are not anti-medicine. Many Amish communities use hospitals for acute surgical emergencies. What they maintained was the everyday medicine, the primary care pharmacy of the kitchen and the garden, that the rest of America was persuaded to discard. 19 more. Number 19. Onion sock for ear infection and fever. The onion sock is the Amish remedy that most Americans encounter first and dismiss most quickly. A raw onion cut in half and wrapped in a cloth or placed directly in a sock is held against the ear of a child with an ear infection overnight. It can also be placed on the soles of the feet for a feverish child at bedtime. The dismissal is understandable. It sounds like magic. The pharmacology is not. Onions contain quercetin and allicin, both with confirmed anti-inflammatory and antimicrobial properties. The warmth of the onion against the ear provides local vasodilation that increases blood flow to the ear canal, supporting immune response. Whether the vapors from the cut onion deliver meaningful concentrations of active compounds through the external ear canal to the middle ear where infection occurs is debated. What is not debated is that quercetin has confirmed anti-inflammatory activity, that the warmth has confirmed benefit, and that the remedy has been used in European and Amish communities for centuries with reported consistent results. Number 18. Cabbage leaf poultice for mastitis and joint inflammation. The large outer leaves of a head of green cabbage, chilled in a cold cellar or a stream, bruised slightly to release the juice, are wrapped around an inflamed joint or placed inside a nursing mother's bra against engorged, inflamed breast tissue. This is the Amish remedy for mastitis, the breast inflammation that can derail breastfeeding in its most critical early weeks, and for the swollen hot joints of arthritis and injury. A 2004 randomized controlled trial published in Breastfeeding Medicine found cabbage leaf application significantly reduced breast engorgement and pain compared to control, and was equally effective as cold gel packs. The active compounds, glucosinolates in cabbage, convert to isothiocyanates on cellular disruption, the same chemistry responsible for the distinctive smell of crushed cabbage, and they have confirmed anti-inflammatory properties. The Amish midwife who wrapped a cabbage leaf around an engorged breast was providing treatment that a randomized trial later confirmed. Number 17. Raw milk and whey for digestive health. Amish communities that maintained dairy herds, which was the majority, understood raw milk as medicine as well as food. The whey drained from fresh cheese making was given specifically to children with digestive complaints, to the elderly with weakened digestion, and to anyone recovering from intestinal illness. Raw milk and whey contain lactoferrin, immunoglobulins, and a diverse population of beneficial bacteria that are destroyed by pasteurization. Lactoferrin has confirmed antimicrobial and immune-modulating properties, and a 2009 review documented lactoferrin's direct antimicrobial activity against a broad spectrum of bacterial and viral pathogens. The debate about raw milk safety involves real considerations of pathogenic contamination risk that vary by farm practice. The nutritional and immunological argument for what raw milk contains that pasteurized milk does not is pharmacologically legitimate. Amish communities that maintained clean herds and responsible handling were accessing immune factors in their milk that commercial dairy removed in the name of safety. Number 16. Horseradish poultice for sinus and chest congestion. Fresh horseradish root grated directly and held near the nose or wrapped in a cloth and placed on the chest was the Amish decongestant for the sinus congestion and chest tightness of respiratory illness. The sharp volatile compounds in fresh horseradish, primarily allyl isothiocyanate, the same compound responsible for the burn of wasabi, stimulate mucus secretion in the nasal passages and airways, thinning congestion and promoting drainage. A 2001 randomized controlled trial published in Arzneimittelforschung compared horseradish root extract to a standard pharmaceutical preparation for sinusitis and acute bronchitis. The horseradish preparation was equally effective, with a significantly better side effect profile. The Amish grandmother, who held a handful of freshly grated horseradish under a sick child's nose, was delivering the same active mechanism as a clinical trial's intervention. The pharmaceutical version required a prescription. The horseradish grew in the garden. Number 15. Flaxseed poultice for boils and infected wounds. The oldest poultice in the Amish medicine chest was linseed, ground flaxseed, made into a paste with hot water and applied as hot as the patient could comfortably tolerate to boils, infected cysts, abscesses, and deep tissue infections that needed to come to a head before they could drain. The heat was the primary mechanism, bringing blood to the area, softening the tissue, and drawing the infection to the surface. But flaxseed contains lignans and omega-3 fatty acids with confirmed anti-inflammatory properties that supplemented the thermal effect. The poultice was applied every 2 to 4 hours, kept as warm as possible throughout the day. The Amish household that maintained a bag of flaxseed in the pantry for poultice use had an infection management tool that was inexpensive, consistently available, and, combined with the drawing action of other poultice agents, often effective at bringing infections to resolution without surgical drainage. Number 14. Peppermint for headache, nausea, and digestion. Mentha piperita, peppermint, was in every Amish kitchen garden and medicine chest. The fresh leaves made the tea for nausea and indigestion. The essential oil, applied to the temples and the back of the neck, was the headache treatment. Menthol, the primary active compound, activates cold receptors in the skin, TRPM8 channels, producing a cooling sensation that reduces the perception of pain through a mechanism that modern pain science has confirmed is pharmacologically valid. A 1996 randomized controlled trial published in Cephalalgia compared peppermint oil applied to the forehead directly to acetaminophen for tension headache. The peppermint oil was equally effective for pain reduction. A 2014 Cochrane review confirmed peppermint oil's effectiveness for tension headache. The Amish elder, who kept a small bottle of peppermint oil in her apron pocket for headache, was carrying an intervention that performed equivalently to acetaminophen in a randomized trial. Here is the economic reality that explains why Amish medicine survived when American medicine forgot it. The average Amish community operates largely outside the insurance-dependent healthcare system. Medical costs are paid directly, shared among community members, and kept as low as practically possible. In this context, a remedy that costs 40 cents and works is not inferior to a remedy that costs $40 and works equivalently. The selection pressure in favor of effective low-cost remedies has been operating in Amish communities continuously since the 18th century. The remedies that survived are the ones that worked reliably enough over generations to be worth the shelf space. That selection process is a form of clinical evidence that formal medical research is only beginning to take seriously. Number 13. Beef tallow balm for skin and wounds. Rendered beef fat called tallow was the base for Amish wound preparations in skin medicine, the way petroleum jelly became the base for modern commercial preparations. Tallow has a fatty acid profile remarkably similar to human sebum, the skin's own oil, including significant concentrations of stearic acid, oleic acid, and conjugated linoleic acid. Applied to dry, cracked, or irritated skin, it absorbs rapidly and restores barrier function. Applied to wounds, it provided a protective coating that kept the wound moist, while antimicrobial additions such as propolis, oil of oregano, and garlic did their work. Amish women prepared tallow balm by rendering suet from the fall butchering, straining it clean, and mixing in medicinal additions. Modern interest in beef tallow as a skincare ingredient has rediscovered what Amish communities never stopped knowing: that the skin absorbs and uses tallow in ways it does not process petroleum-derived alternatives. Number 12. Oil of oregano for nail fungus. The toenail fungal infection that affects approximately 10% of the American population and that pharmaceutical antifungals treat with limited success was treated in Amish communities with oil of oregano applied directly to the affected nail twice daily for 3 to 6 months. Those pharmaceutical antifungals cost between $400 and $800 for a course of treatment and carry liver toxicity warnings. Carvacrol in oregano oil has direct fungicidal activity against Trichophyton rubrum, the dermatophyte responsible for most nail fungal infections. A 2001 study in the journal Mycopathologia confirmed carvacrol's significant antifungal activity. A 2011 study in phytotherapy research confirmed oregano oil's effectiveness against Candida biofilms, the protective matrix that makes fungal infections resistant to treatment. The Amish treatment costs approximately 40 cents per application. The pharmaceutical alternative costs hundreds of dollars, requires liver function monitoring, and has a lower success rate than most patients are told. Number 11. Catnip tea for fever and infant colic. Nepeta cataria, catnip, was the standard fever remedy for children in Amish communities and the first treatment for the infant colic that made households miserable through the first months of a baby's life. A mild tea of the dried herb, cooled and given in small amounts to infants or in a full cup to older children with fever. Catnip contains nepetalactone and rosmarinic acid, the same anti-inflammatory compound found in lemon balm and self-heal, along with thymol, which has confirmed antimicrobial properties. The diaphoretic effect of catnip tea, which promotes mild sweating, is consistent with its traditional use for fever management. For infant colic, the antispasmodic properties of the herb reduce intestinal cramping, the same mechanism that pharmaceutical simethicone drops address through a different chemistry. A 1993 study in the Journal of Pediatrics found herbal tea preparations, including catnip, comparable to simethicone for infant colic. The Amish household that kept dried catnip for the colicky baby had an evidence-supported intervention. Number 10. Hyssop for respiratory illness. Hyssopus officinalis, hyssop, mentioned in the Bible and carried to America by Mennonite and Amish communities from the European herbal tradition, was the respiratory herb for chest infections, coughs, and the bronchitis that settled in through winter. The leaves and flowering tops made a tea that promoted expectoration, soothed inflamed airways, and had direct antimicrobial activity against the pathogens most common in respiratory infection. Ursolic acid and rosmarinic acid in hyssop have confirmed anti-inflammatory and antimicrobial properties. A study in 2002 documented hyssop's antimicrobial activity against respiratory pathogens, including Staphylococcus aureus and Haemophilus influenzae. The plant has been in continuous medicinal use from biblical times through Amish communities in 21st century Ohio and Pennsylvania. The continuity of use is itself a form of evidence. Remedies that do not work do not survive 3,000 years of human use. Number 9. Juniper berry for kidney and urinary complaints. The juniper berries that flavored gin and provided one of the most distinctive aromatics in European cooking were understood as medicine in the Pennsylvania German tradition. Amish healers used juniper berry tea for kidney complaints, urinary tract infections, and the edema, the swollen ankles and retained fluid that came with kidney dysfunction and aging. Juniper contains terpinin-4-ol, the same diuretic compound found in tea tree oil, which has confirmed diuretic and urinary antiseptic properties. A review in the Journal of Ethnopharmacology documented juniper's traditional urinary applications across multiple cultural contexts and confirmed the pharmacological basis for its diuretic and antimicrobial activity in the urinary tract. Gin, the popular drink made from juniper, was originally sold in Europe as a medicinal preparation for kidney and urinary complaints before it became a recreational beverage. The Amish healers using juniper tea for urinary infection were working from the same pharmacological understanding that launched an entire beverage industry. Number 8. Ground ivy for ear and sinus complaints. Glaucoma heteracea, ground ivy, creeping Charlie, the small-leafed aromatic plant that spreads across every lawn that does not use herbicides, was one of the most widely used herbal medicines in the medieval European tradition and carried directly into Amish practice through the Pennsylvania German lineage. Called gill over the ground in older texts, it was used specifically for ear complaints and sinus congestion, conditions for which modern medicine still has limited pharmaceutical options. Fresh juice was pressed from the leaves and dropped into an aching ear. Tea was drunk for sinus congestion and the chronic inflammation of the nasal passages. Rosmarinic acid and ursolic acid and ground ivy have confirmed anti-inflammatory and antimicrobial properties. The plant grows in most American lawns as an unwanted weed. Amish households of Lancaster County, Pennsylvania, recognize it as the ear medicine and let it grow. Number 7. Coltsfoot for cough and bronchitis. Tussilago farfara, coltsfoot, was named for its primary application. Tussus means cough in Latin. The plant that appeared in early spring, before its leaves emerged, with bright yellow flowers like dandelions, was gathered and dried specifically for the chest complaints of winter and spring. The persistent bronchitic cough, the mucus that would not clear, and the chest tightness that made breathing labored. Amish communities used coltsfoot preparations for the same applications that European herbalists had used them for since Roman times. The plant contains tussilagon and other sesquiterpenes with confirmed bronchodilatory and expectorant properties. Controversy exists about pyrrolizidine alkaloids in the plant at high doses in animal studies, and traditional preparations use the leaf and flower in quantities well below the levels shown to cause concern. The Amish tradition of coltsfoot tea for winter chest complaints represents a 2,000-year-old clinical protocol. Number 6. Thyme tea for respiratory infection. Thymus vulgaris, the kitchen herb used in every Amish soup and bread recipe, was also used as medicine in Amish households. The same herb that flavored the bread made the tea for bronchitis, for the persistent chest cough of respiratory infection, and for the sore throat that came before and after it. Thymol is one of the key compounds in thyme, the primary antimicrobial compound found in oil of oregano and in Listerine mouthwash, and thyme also contains carvacrol and rosmarinic acid. A randomized controlled trial in 2006, published in Arzneimittelforschung, compared thyme extract directly to the prescription expectorant Ambroxol for acute bronchitis. Thyme extract was equally effective. A 2012 study found thyme syrup to be superior to placebo for bronchitis symptom relief. The herb that grew in the kitchen garden and seasoned the evening meal was also the afternoon tea for the sick child in the next room. The Amish household that grew thyme did not need to choose between the kitchen and the medicine chest. It was the same plant. Number 5. Charcoal poultice for infection and spider bites. Activated charcoal mixed with water or with ground flaxseed into a paste, then applied as a poultice to infected wounds, spider bites, and areas of deep infection, was an Amish emergency intervention when infection was progressing faster than simpler remedies could address. The adsorptive capacity of activated charcoal, its ability to bind toxins and pathogens through electrostatic attraction at an enormous surface area, works the same way applied externally as it does when taken internally. A charcoal poultice applied to a brown recluse spider bite draws the necrotic compounds toward the surface and may reduce the area of tissue death. Applied to a rapidly spreading skin infection, it removes the bacterial toxins from the tissue margin that are driving the inflammatory cascade. The Amish grandmother who made a charcoal poultice for a bite that was turning necrotic had no pharmaceutical alternative available, and she held a pharmacologically rational intervention in her hands. Number 4. Spearmint for digestion and children's medicine. Mentha spicata, spearmint, was the gentler mint kept specifically for children's medicine in Amish households. Where peppermint was used for adult headaches and stronger complaints, spearmint was the digestive herb for children. The tea, given for colic, for the stomach cramps of childhood digestive illness, for the nausea of fever, and as a pleasant tasting base for other medicines that children refused. The lower menthol content of spearmint compared to peppermint made it more suitable for small children, for whom high menthol preparations can cause respiratory distress. Carvone, the primary aromatic compound in spearmint, has confirmed antispasmodic properties in gastrointestinal smooth muscle. A 2014 study confirmed spearmint extract's significant antispasmodic effects in intestinal tissue, comparable to standard antispasmodic pharmaceuticals at equivalent concentrations. The Amish household that kept a pot of spearmint growing at the kitchen door had a pediatric digestive remedy growing within arm's reach. Number 3. Potato poultice for burns and inflammation. A raw potato, grated or sliced thin, and applied directly to a burn or area of skin inflammation, was the immediate first response in Amish households to minor burns, sunburn, and the inflamed skin conditions of summer. The high water content of raw potato provided immediate evaporative cooling. The catecholase enzyme in raw potato has anti-inflammatory properties. The starch formed a thin film over the skin's surface that protected the damaged tissue from air and contamination, while the cooling effect continued. Ethnobotanical research has documented potato poultice use across European, Indigenous American, and Asian traditions for burn treatment, a convergent discovery that suggests the observation of its effectiveness crossed cultural boundaries independently. A 2012 study in the Journal of Wound Care found moist potato peel dressing comparable to standard silver sulfadiazine cream for minor burns in terms of antimicrobial effectiveness and healing time. The Amish response to a kitchen burn to grab a potato from the root cellar was clinically validated. Number 2, rose hip syrup for winter immunity. The same rose hip syrup that appeared in the Pioneer Women episode of this series returns in the Amish context because the preparation and the intention were slightly different. Amish households made rose hip syrup not as an emergency vitamin supplement, but as a daily winter tonic. A tablespoon was given to every member of the household from October through March as a preventive measure against the respiratory infections that move through farming communities in cold months. The preparation was more concentrated than the Pioneer tea. The hips were simmered, strained, and reduced with honey into a thick syrup that delivered far higher vitamin C concentrations per dose than the Pioneer preparation. A single tablespoon of concentrated rose hip syrup can deliver 100 to 400 milligrams of vitamin C, 1 to 4 times the daily requirement, in a form that children accepted readily because it tasted good. The Amish Winter Tonic was systematic preventive nutritional medicine administered daily. Number 1, lard and beeswax healing salve. The base salve of the Amish medicine chest was the preparation that served as the carrier for every topical medicine the household needed. It was rendered lard combined with beeswax and whatever medicinal additions the specific application required. Propolis for antimicrobial action, arnica for bruising, oil of oregano for fungal infections, comfrey root infused oil for bone and tissue healing. The lard and beeswax base was not a neutral carrier, it was pharmacologically active in its own right. Lard's fatty acid composition closely mirrors human sebum, allowing it to penetrate the skin barrier in ways that petroleum-based carriers do not. Beeswax creates a breathable protective film over wounds and damaged skin that reduces water loss and contamination without creating the occlusive barrier that traps infection. A 2003 study in Archives of Dermatological Research found beeswax and honey preparations significantly effective against the bacterial and fungal pathogens most associated with skin infections. The Amish salve tin was not folk medicine dressed up in old language. It was a sophisticated delivery system for active pharmaceutical compounds in a base specifically suited to skin absorption. 25 remedies. From communities that never stopped practicing the medicine, the rest of America was told to throw away. The Amish did not keep these remedies out of stubbornness. They kept them because they worked reliably enough, generation after generation, to be worth maintaining. The clinical literature has been confirming them one by one. Walk through any Amish farmers market in Pennsylvania, Ohio, or Indiana, and look at what they sell in the herbal and remedy section. Every jar, every bottle, every dried bundle represents a piece of knowledge that was almost lost. Subscribe to Forgotten American Ways. We are going to keep bringing it back.